Shoulder dislocation occurs when the ball is dislocated out of the ball and socket joint that makes up your shoulder. We classify them based on the direction the ball goes relative to the socket. Out the front we call that an anterior dislocation. Out the back we call that a posterior dislocation. And if it goes out the bottom we call that an inferior dislocation. And the anterior is the most common by far. An anterior dislocation occurs most commonly with the shoulder in an abducted position where the elbow's at the shoulder level and the hand gets forced in an externally rotated position, gets forced backwards. And that causes the ball to pop out of the socket anteriorly. So when the shoulder dislocates out of joint, it tears the labrum and the capsule of the ligaments that stabilize the shoulder off of the socket. And that doesn't heal. That creates sort of a pathway for the shoulder to remain unstable or dislocate. The most important thing once the shoulder is dislocated is for it to be put back in place. And we try to do that as quickly as possible. If it's obviously dislocated and we see it happen in the field of play, we would put it back in place at that moment. In a hospital setting or in a car accident setting in the emergency room, we may get an x-ray first to confirm that it's out of joint and then pop it back in place. But usually the sooner we can get it put back in place, the sooner the treatment can begin and the patients will certainly be more comfortable. Surgery for shoulder dislocation can be done in many different ways, either through a full open incision or small arthroscopic incisions. Whenever possible, I favor the arthroscopic surgery as it is less invasive and perhaps the recovery may be a bit faster or at least less painful. Through surgery, we're able to arthroscopically or through an open surgery literally repair that capsule and those ligaments to restore the stability of the shoulder. And our goal is to repair it exactly back to where it was before it was torn. Once that's been accomplished, the recurrence rate is fairly low, somewhere in the single digits. And probably the most important factor is the activity that the patient is involved in. For example, a contact athlete would probably have a higher recurrence rate than someone who had a desk job. Typical recovery as time would range somewhere between 3 and 4 months. Certainly at least 4 months before returning to contact sports. Generally, a sling would need to be worn for about 4 weeks after the surgery, and rehabilitation or rehab would start almost immediately after the surgery to regain strength and range of motion. Usually by 6 to 8 weeks, the patient is out of the sling with full range of motion and is working on regaining their strength.